Namaskar and good evening. I welcome all the viewers to Yoga Research Study Circle under the umbrella of WHRF, Women's Health Research Foundation. WHRF works for women empowerment to make them self-reliant and confident. Yoga Research Circle conducts sessions on every Sunday where we invite experts from different fields to share their knowledge with us. Our details can be found on our WHRF Facebook page and WHRF site. Our today's expert is Dr. Harpreet Ratra, who is a dentist. She is a root canal laser dentistry specialist. She is an ardent follower of painless dentistry and uses unique blend of dental expertise and modern procedures to bring smile on her patients. So I welcome Dr. Harpreet Ratra on behalf of WHRF. Over to Dr. Ratra.
Hello everyone, this is Dr. Harpreet Ratra. Before I begin with my session, I would like to give my special thanks to Rachna ji, Sunit ji, and the whole team of WHRF for giving me this opportunity. Today I am going to talk about our oral health and the relationship of our oral health with our overall health. Oral health is essential for good health and well-being. Our mouth is considered healthy when we have healthy gums, strong teeth, clean tongue with a clean breath. So then we can say we have a good oral hygiene. Now let's come to the agenda for the talk. Firstly, I'm going to cover oral health and its importance, difference between a normal tooth structure and a damaged tooth structure, from where we can actually look into the detail of dental problems. Then coming to the common dental problems with its prevention and treatment. Some dental tips for your healthy mouth, 10 important things for your child's dental health, mouth and body connections, which is the main focus of my talk, where I'm going to discuss certain signs which should never be missed, which are the mirror for systemic diseases. Lastly, I'm going to give you an update about the latest developments which have come in the field of dentistry. So why is good oral hygiene so important? It gives us beautiful smile, healthy teeth, gums and bone, overall good physical health, and which tends to prevent tooth decay, toothache, infections, bleeding gums and loosening of teeth. Let's come to the normal tooth structure so that you can actually understand how and with what a tooth is made of. Tooth has 3 layers. Firstly, the outer layer is known as enamel, which is the hardest one. Then comes the dentine and then the core, which is the pulp. It has all the nerve tissue and the blood vessels supplying the tooth, which makes it live. Now come to our damaged tooth structure. Let's see at what level the infection reaches, leading to a damage. If the upper layer of the tooth structure is damaged, that is the enamel, minimum cavity creates. And if it invades the inner layer, that is dentine, you start to develop little sensitivity. Then, if it enters the blood vessels, the core portion of the tooth structure, then it leads to severe pain. Let's come to the dental problems which commonly occurs and we need to address them on time. First, the tooth decay, bad breath, mouth ulcers, tooth sensitivity, gum disease and a missing tooth. Do you know the real culprit behind this all oral dental problems? It's our own dental plaque. What is it? It is a naturally occurring mass of bacteria which is present in our own mouth. It tends to solidifies over the tooth surface, the gum, and it leads to tooth problems as well as gum problems. I will give you a complete detail how it spreads inside the tooth surface and how it leads to your gum problems. When you don't brush for a one day, you can actually feel a one thin layer of white substance which rests onto your tooth surface. And if you don't remove that, how you remove that? That is by normal brushing. If you don't remove, it just sits onto your tooth structure and it tends to solidify. When dental plaque grows on tooth surface, there is acid produced by the bacteria which are present in it, which leads to cavity. And cavity, as you know, it can extend from the upper layer to the deeper layers. So that will lead to a tooth problem. And if this dental plaque sticks to your gum surface, it may lead to inflammation of the gum, leading to further problems, most commonly known as bleeding gums. Dental cavity or dental caries. These are the permanently damaged areas onto the tooth surface which results from the sticking of the food and the action of the bacteria, leading to the damage to the tooth. Causes of dental caries: poor oral hygiene, intake of sweet and sticky food, bad or worn out fillings, dry mouth, or crowding of teeth. After knowing these all causes for dental cavities, how we can prevent them? We should eat healthy food, brush our teeth after every meal, use fluoridated toothpaste, and we should avoid all the sweet and the sticky food. And not to forget, we should all visit our dentist every 6 months. If you have any problem or you don't, just get a normal checkup. Just to give you all an insight to the treatment of caries, it all depends on to the extent from where the bacteria has entered and how much damage it has caused. Is it to that enamel level or dentine level, or it is inside the nerve? So there are most commonly 3 methods or 3 treatments which are available. Firstly, you can undergo normal fillings. Second, you can undergo root canal treatments to save the tooth structure. And if you have damaged your tooth structure to that level, you may end up having removal of that tooth structure so that it doesn't spread infection to the side ones, and you can get a further replacement with the latest technology of implants. We just covered dental plaque. When it stays onto the tooth structure, it leads to cavities, and when it stays onto the gum, it leads to gum problem. That is the most common problem which every individual faces. People tend to say, I have food enlargement happening, I have bleeding gums, I'm feeling as if my teeth are moving, they are having big spaces. When this plaque rests on the gum structure, it leads to, first and foremost, the inflammation. Inflammation is sogginess of the gums. When the plaque rests on our gum surface, it tends to solidify with the increasing count of bacteria. It leads to the inflammation of the gums, which you can see as redness of the gums. When you touch your gums, they are red, they are painful, and they bleed when you brush. These are the most common signs which an individual can appreciate. This is a gum level disease, most commonly known as pyorrhea. And when this disease enters inside the bone, it leads to the loosening of the teeth, and your whole gum level moves down, leading to the movement of the tooth structure. Then it leads to periodontitis, further commonly seen as pockets where the food rests, and then the bacteria from the gum enters in the tooth structure as well, leading to root level caries, movement of the teeth. Periodontitis, which is a serious gum disease, when it extends from the upper gum to the supporting structure of the tooth structure. It is fairly very dangerous but it can be prevented. When it reaches the lower jawbone, there is loosening of teeth and further damage of the tooth structure. Let's cover the treatment of these gum diseases. Most commonly, everyone is afraid of getting any gum treatment or any cleaning. Everybody says, we'll get loose teeth, hawa lagegi, thanda lagega, sensation will increase. That is all myth. The way you clean your house, you need to clean all the tartar which is sitting onto your tooth structure. If we don't clean, there is no growth of gum, there is no blood vessel which is going to breathe, there is no growth which is going to happen. You can all see in the first picture that is showing scaling of the teeth, before and after. Before, you can see the gums have moved down, there is brownish, yellowish tartar which is moving the gums down, and once we remove this whole layer of tartar from this area, within some days the gum tends to grow back and attach to the tooth structure. So mainly we should go for good oral hygiene practices, scaling and root planing. Finally, if you don't address these problems at the initial level, you may undergo a normal surgery which is called as periodontal surgery. Nowadays it is all done with latest lasers also, which tends to improve the gum health and do a bloodless, sutureless surgery. The presence of your teeth is felt when you have tooth sensitivity. Either you are not able to eat your favorite ice cream, you are not able to put ice cubes into your mouth, you are not able to eat and enjoy your favorite rasgulla or a hot gulab jamun. You tend to have sensation that something somewhere is not right. You need to check your teeth. What is causing this sensation? From where it is coming? And what is the root cause of this? Is it your cavity? Is it your wrong brushing? Is it your intake of too much of carbonated drinks? Or too much intake of amla, lemon? And if you have acidity, which we never connect with any dental problem. We think only teeth, that means only cavity or some sweet intake has led to this. We should be knowing the real cause and get it treated in time. Keep all this in mind to prevent tooth sensitivity. You need to do your brushing in a right manner. You should not be putting a lot of pressure onto your teeth. As people think once they are brushing, they should put a lot of pressure to clean them, or using hard bristle brush. That is going to ruin your enamel. That is removing the upper layer, leading to porosity in the enamel and seepage of the sensation inside to the nerve. How we can prevent this tooth sensitivity? We need to localize the cause. Firstly, you have to check your brushing technique. Are you doing the right brushing method? Or you're doing to and fro? You're putting a lot of pressure on your teeth, using a hard bristle brush, which is a complete no-no. Rightly, you should be using your brush in a circular manner with a less force, so that you're not ruining the tooth surface. You should consume less acidic food like lemon, amla, and some sugar-free chewing gums should be encouraged with the children, so that it doesn't lead to any further cavities plus a damage to the tooth structure. With this, stop usage of carbonated drinks. It releases acids and damages the tooth structure, creates passages for the bacteria and food substrate to move inside the tooth to damage it. Then comes the bad breath. In dental terms, it is called as halitosis, and people address it as foul breath. You are not confident talking to others, you are getting conscious. So looking for the causes. See, all the causes are interlinked. There is a big list which I am going to count every time. So I would like to name a few, starting with accumulation of plaque, calculus, gum disease, caries, dry mouth, some bacteria sitting on tongue. You have some pus collection with respect to one or the two teeth, or oral cancer, with smoking, and the other causes which are digestive problems, sinusitis, which we never link with our dental problems. How you can prevent this bad breath? You should get a treatment for the underlying cause. Smoking should be stopped. Avoid certain foods which leads to this bad breath, like some acidic food, carbonated drinks. And then most important is keep yourself hydrated. Drink ample amount of water to flush out all the bad toxins. I think we have covered too much of dentistry. Let's come to some aesthetic part, which everyone is bothered. The smile. Smile correction is separate, but discoloration is the most common thing. People tend to take tobacco, the intake of coffee, or which we never try to address is the fluorosis. It can be due to increased intake of fluoride content in your water. When should I take my child to a dentist? Parents tend to forget that your children also require dental care to maintain their oral hygiene. Early visits will prevent further dental problems. We need to address some very important tips, or during their growing age, what we should be taking care for their dental health. So now I'm going to tell you how you can protect your children's teeth. Normally, we tend to avoid any cavity, any discoloration in the younger children. We tend to say, we are going to get permanent teeth. Let's wait. How are they important? But they are very, very important. If this cavity is going to stay for longer, your child will have a lot of problems in eating, chewing. So you need to address them. If a child is keeping food in his mouth for longer period of time, you should discourage that habit. You should make them eat fast. Remove them from in front of the cameras or TVs. They are more engrossed in the TVs. So they are not addressing any chewing habit. Try to inculcate good habits in them. Give them less sugary stuff. Limit their snacking. You need to encourage them for good brushing, at least for 2 minutes and 2 times. Give them less carbonated drinks. And even in infants, you should make sure that you are cleaning their teeth with a finger brush, or if they are too small, with a muslin cloth which is dipped in clean water, and then you wipe the surface even after when you give them nursing bottle. Till now, I believe I have given you enough information about dentistry. I think you all. Now I want to discuss with you all the most important topic of my presentation. That is the mouth and our oral health connection, which we never think. We think dentistry is separate, oral mouth disease is separate, our body is different. They are not interlinked. But here you are wrong. We need to address a lot about this. So I'll be covering all important topics in this, which will make you aware. In our respiratory illness, these bacteria are inhaled from the mouth only, inside the lungs, and they can even cause pneumonia. Similarly, these bacteria can move inside the brain or the blood vessels running from the brain to the face, leading to oral and facial pains, or Bell's palsy even. Sometimes they can enter joints, leading to inflammation of joints, known as rheumatoid arthritis. So we don't link those inflammations or the joint problems with these oral manifestations. We tend to see we are getting old. Due to that it is happening. Sometimes the infection is coming from somewhere else. So address that. Most important is the premature birth. How it is linked with a pregnant lady? This gum disease can cause a lot of problems. The bacteria from the mouth can travel through the placenta, which is connecting the mother and the child. It can instigate the release of certain hormones, which will lead to preterm labor and early deliveries. So keep a check on your gums. Due to hormone changes, lot of happenings are going on inside your mouth. So it's my humble request to all of you. Please connect your problems with your mouth. Don't ignore them. Our mouth is a mirror of our overall health. So don't ignore these signals from your mouth. like red and white patches in your mouth, ulcers which do not heal, some burning sensation in your mouth, dryness in your mouth, bleeding gums, bad breath. Sometimes they stay for longer period. We try many therapies to treat them. I think I have educated you all enough. Now let's upgrade you all with the latest development in dentistry. Agreed, teeth are for form, function, but our aesthetics is also important. We should have a confident smile. An unattractive smile kills your confidence. There are many factors like the teeth are bigger or longer in size. They give me bunny look. Or some people say you look cute, but you're not confident. Then comes you have irregular teeth. Or there are some spaces between the teeth and the tongue starts pushing your teeth and creates spaces. We can improve and correct your smile by 3 treatment options. Firstly, braces, the most common and the oldest method, but there are many types which are available. Metal braces, ceramic braces, colored braces, invisible braces, lingual braces. Many people don't want to wear braces. They want to have their correction without braces. So the latest technique is aligners. These are clear, transparent and removable. You can remove while eating food. You just need to wear them for 16 hours a day, 12 hours at night and rest during the daytime. That is nowadays the best option. So friends, this is the aligner. Clear, transparent and removable. The third option to correct your smile is by laminates, veneers, zirconia capping and even with laser whitening. That is the safest method of whitening without any side effects. Now you're all aware of all the options available for correction of smile. You can choose any of the technique which falls in your budget and consult your dentist for a confident smile. Don't leave a missing teeth. Your teeth are just like a diamond necklace. You have a missing teeth, it can be replaced by these 3 options. Removable dentures, bridges or caps, or the latest is the dental implant. This is a fixed tooth ranging from a single tooth to multiple tooth. What is an implant? Implant is a complete replica of a tooth. The way teeth have 2 parts. One, the upper crown and the root portion which is not visible, which is inside your crown. Similarly, an implant has 2 parts. The upper portion and the lower portion which goes inside the bone and simulates your root. This is an actual implant, and when it gets osseointegrated, that is binds with the bone, we place the second attachment and then a tooth is placed over that without disturbing the integrity of this and this side teeth. So don't wait till dentures. Replace your missing teeth with this best option. You'll be really happy after that. I will surely discuss this topic in detail in my next video. My special thanks to everyone for hearing me so patiently. Thank you so much. Thank you so much to the team of WHRF for giving me this opportunity. And my special thanks to Rachna ji and Sunil ji for giving me this honor.
Thank you very much, Dr. Ratra, for such a wonderful session. I'm sure most of us would like to take the tips that you shared so that we can take care of our dental health, especially those who have young children at home and even the elderlies. So thank you once again on behalf of WHRF. We would like to have more sessions with you in future. Thank you.